right, let's move on to some capsules, man. So what did we do last week on the exam? Powders. What are you doing today? Powders, but in a capsule. So realize there's some similarity. Last week we were making a topical powder, something to use externally. Now what we want to do is take powders and consume them internally in an effective way for dosing and for swallowing and for consuming those powders. And capsules really do work best. So quick definition of capsules are they are solid dosage forms in which this drug, usually in the form of a powder, but not always, is encapsulated or essentially enclosed in a either hard or soft gelatin capsule. So just to be clear, mainly what you think of as a capsule and what you're going to be making today and next week is a hard shell gelatin capsule. They're kind of your normal capsules, but they do make soft shell. And when you do a soft shell, it's usually because you want to encapsulate a liquid, because you can do liquids. So let's see, have you ever seen one of those red DocuSate capsules? They're kind of like red little football things. Or maybe the longer nifedipine capsules themselves. They'll sometimes cut those and squish the liquid out under the tongue. Or benzonatate, the little round yellow roly-poly ones. Those have liquid encapsulated in this gelatin, but it's a soft shell gelatin. They're much more difficult to do. You actually have to kind of inject the liquid in there, pull it out, and heat seal the capsule so it doesn't leak. So those are more specialty. So what we are going to do are powdered, encapsulated. So we're going to put those in the hard shell gelatin capsules. All right. Now, you're going to make these. Well, how do we ensure that you make a good product? These are kind of important to understand the procedures and everything else. The first thing to understand about these capsules is they have to have the right amount of weight. They have to have the right amount of powder in there. So accuracy in your weighing is paramount. I can't explain that enough. Because if you think about it, a lot of active drugs that you put in a capsule might need just like 1 milligram, 5 milligrams. They're highly potent drugs. So you need actually very small weights. So even if you think about your weighing and measuring from last week, the precision and correctly tearing the weigh boats and tearing with an empty capsule, as we'll talk about, and so forth, making sure the capsules really do have the correct weight is paramount, the most important thing. And it's going to be the harshest thing we grade about your final product. It has to weigh what it's supposed to weigh. Okay, so keep that in mind. The other thing that explains the drop of food color that we're going to talk about and everything later is you have to homogeneously blend, because it's not just active drug. If you think about this, have you ever seen a 1 milligram tablet or a 5 milligram tablet of a drug? If they were pure drug, then that tablet would only weigh 1 milligram or 5 milligrams. That's like you can't even hardly hold a 1 milligram. You can barely see 1 milligram of powder. So understand that all of your commercial tablets and capsules are not just pure drug, or not bulk drug powder. They're a mixture of drug plus some diluent. For example, today you're going to be using lactose for your diluent. And that's because you need to have enough powder to even just be able to hold, or in your case today, to be able to fill a capsule. You have to fill a capsule slightly packed, meaning mostly full. So the active drug wouldn't be enough powder to do that. So mixing the little bit of active drug with a lot more diluent is absolutely essential. If you don't mix it correctly, then one capsule has 1 milligram and another capsule has 10 milligrams. That would be no good. So we got to make sure that and you'll see today, you'll use food color to visualize this homogeneous blending. All right. Third is capsule size selection. Normally when you compound a capsule prescription, the prescriber does not indicate what size of capsule to use. That's kind of the art form that the pharmacist chooses. So hopefully from watching the podcast, you realize there's a variety of different sizes, right? So let me ask you this. So let's say I was going to give you guys, say, a happy pill. Some of you could probably use a happy pill. Would you prefer to swallow that pill as a capsule as in a size 5 or a size 000? Which one would be better? See, that's a trick question, because the size 5 is really small and easier to swallow. 000 would give you a lot more happy. Okay, so you get more drug in a happy 000, but you'd be doing this, choking to death, because a size 000 isn't even intended for human consumption. That capsule is so large, you choke to death. It's intended for a horse. It truly is a horse pill, a 000 capsule. So take-home message is, I didn't invent the system. It's kind of weird. The larger the number, the smaller the capsule. So size 5 capsules are the smallest. Size 000 are the largest. The two that you're going to need to know for me that are most commonly used for human patients is size 2 and size 3. Therefore, size 3 is a little bit smaller than a size 2. So if you've got a pediatric patient or a patient who has difficulty swallowing, a size 3 might be better. For a normal adult, then size 2 is actually easier to compound with. And that's what you'll be doing today, is size 2s, okay? But you will choose the capsule. And then lastly, it has to look good. And I say that because hopefully if you watch the video, you know you're going to open up the capsule, you have your little powder, and you punch it up and down, up and down, up and down, punch, and then you put the cap on, and then you weigh it. All right, you have to get the right amount of powder into the capsule. Well, at first, it takes you a while to kind of get that figured out. And so you may put too much, and then you take some out. And then it's not enough, and so you have to put more in. And you take some out, and you put some in. And by the fifth time of you manipulating that capsule, it's all dusty, it's all bent because you've been squeezing on it, and it's gotten some fingerprints on it, and it's a mess. So you really, at that point, need to just dump the powder out and start all over again. Because in the end, your capsule that has the right weight of powder has to be nice and shiny, and it has to be pinched closed and so forth. So we're going to make sure that it has a quality appearance when you're done. Okay, those are the main things we're going to use to evaluate your capsules today. All right, now to get into this, the last thing I want to say is you're going to have extra powder. Trust me on this. I know some students have talked about it. It was a little confusing because on my podcast, I said USP 795 says you have to prepare at minimum 2 additional capsules, okay? For lab, trust me, that would not be enough. Many of you would still struggle, especially making your last capsule or so, because there just isn't enough powder left for you. So today and on the exam, I want you to base all of your calculations on the preparation of 4 extra capsules. So be clear on that. You're going to make enough powder to be able to have 4 extra capsules, but you're only going to punch and only dispense the prescribed quantity. So you have enough powder to prepare excess, but you only prepare the quantity to dispense. All right. And for us today, that'll be to prepare 4 additional capsules. Last thing, I just need to make sure it's clear on this is capsules. All right. So there are different sizes. You look on this table here, 5 is the smallest, going over to 000 on the right. The numbers in this table represent the maximum weight of powder you could physically stuff into that size of a capsule. And I want to emphasize this. Capsules have a fixed volume. The different sizes have different volumes, but that volume is fixed. So understand you compound capsules by volume. You stuff powder in there until you have filled up a certain amount of volume. Okay. The problem is, though, that the drug you're putting in that is dosed by weight. So you have to put the right weight in the capsule, but since powders have different densities, that weight will occupy different volumes. All right. So in the end, what I'm getting at here, if you look now going down the rows here, not columns, but rows from drug to drug to drug on this table, you will see that the maximum capacity. So if we do focus on size 3, for example. And so you can see, looking down here, you can have a quinine, for example, you could fill that would only have a weight of 0.12 grams when it's totally full. Why? Because quinine isn't very dense. It has big particles that aren't very heavy. So you can't put much weight in that same volume capsule. Compare that to something like bismuth subnitrate, where you could get almost 0.4 grams in that same volume. Why can you get so much more weight in there? Because that powder is much heavier. So powders have different densities. Since most of the volume of that capsule will be taken up by the diluent that you're going to use, what we're going to do is what you'll do today in lab and on the exam is use lactose. You're going to use whatever volume or weight of isn't going to be active drug, it will be lactose. And we're choosing lactose because it is an ideal chemical for using capsules, because you'll see here it's compressible. If you mush it down, it stays down. It becomes kind of sticky, which is important because as you're punching up and down, you want the powder to stick inside the capsule. So that property of its compressibility and its ability to stick inside the capsule as you punch it makes it ideal for making capsules. However, there may be situations where maybe someone's lactose intolerant. And even though there's really not very much lactose, if you needed to avoid lactose, there are other chemicals that you could use. But think about this. Talc would be a terrible chemical to use. Do you remember using talc when you were doing it kind of like floofed up into the air? It's very fine particles that aren't sticky at all. Once you punched it and lifted that capsule out, the talc would just all fall right back out. So again, that's why there are certain chemicals we use when making capsules because of their properties. Lactose is the one that you need to know. So looking at this table under lactose, say for example, for size 3, you can see there on the table, the maximum you could do is 0.28 grams or 280 milligrams. You could not stuff any more lactose than 280 milligrams in the volume size of a size 3 capsule. So should that be a good target weight to use? No, that would be terrible. You'd have to keep packing and packing and packing until it's totally full. That's too hard. But we need to put enough powder in there that it is slightly packed, not loosely. We don't want the powder sloshing around in a half-empty capsule. So we say that you need to go somewhere between the maximum and 75% of maximum. So if you take 280 times 0.75, you see that's 210. So arguably, you need to fill a size 3 capsule somewhere between 210 and 280. There's no right and wrong. It'd probably be better to be kind of in the middle. And most importantly, let's choose a convenient number, an easy number that makes our calculations better. There's no reason to choose 261. That's a weird number. So in the end, I'm telling you, we're going to hold you this. So this is a memorization alert. I expect you to come next week memorize, knowing that if I'm using a size 3 capsule, whether it's on the wet lab or on the errors and omissions, that a size 3 capsule's target weight ideally is 250 milligrams. 250 is kind of right in the middle between the capacity, and it's a nice, easy number that makes your calculations easy and more correct when you do them. So memorize, size 3, target weight is 250. For the same reason down below, you can see my numbers. A size 2 capsule, remember, which is a larger capsule. Size 2 capsule's ideal capacity for target is 300 milligrams. So memorize that. Size 2 equals 300 milligrams. Size 3 equals 250 milligrams. I'm going on from this point knowing that you have that memorized, okay? All right, let's go through our dry lab prescription. That's enough background. So let's read and interpret the prescription here. We have one for Bob Sykes, and if you actually look at his profile, you'll see that he's kind of an elderly patient. I think he's 60, 65, like that. So somewhat elderly patient. Is wanting indomethacin 12.5 milligrams, and it says to make those as oral capsules. So we want to make 12.5 milligram oral capsules of indomethacin. We're going to dispense 6 of those, and you can see the instructions there. So the first thing we're going to do before we look at the additional information or anything else, we got to make sure that that's a reasonable thing to make, because here, this is a trick. Indomethacin is a commercial product. It already comes as a capsule. You should never compound a capsule that already is made commercially. All right, but wait a minute. What size does it comes in? It comes in indomethacin 50 milligrams. It comes in indomethacin 25 milligrams. It does not come in a 12.5 milligram capsule. Can you take half a capsule? Can you break a capsule in half? No. So you can't do that. But here's the deal. If this came as indomethacin 25 milligram tablets that you can break in half, then I still wouldn't compound these capsules. I would tell them to take a 25 milligram tablet and cut it in half. But as a capsule, that's not practical. We can't do that. More importantly, it's reasonable to give a low dose of indomethacin, which is a non-steroidal anti-inflammatory, or an NSAID. Think of it like an ibuprofen that's used for arthritis pain. But those medicines, all of those, are really rough on the stomach. So a geriatric patient who's at risk for a GI bleed may very well need a lower strength of this indomethacin to try to reduce the side effects. So preparing a low strength of indomethacin for him in a capsule that's not commercially available is very reasonable. So let's make this thing. So we're going to make it. Now let's look at the additional information. There's some things here that I will not remind you of on the test next week, which is to base your calculations on the formulation for 4 additional capsules. Even if we're not going to punch those extra 4, we're going to have enough powder to punch a total of whatever we're going to dispense plus 4 capsules. Okay. And that we have to make a choice. Remember, the doctor didn't indicate which size capsule to use, so we have to make a choice. So we're choosing to use size 3. Since this is a geriatric patient who may have some problems swallowing, let's use a size 3 capsule, and therefore, you've memorized, an appropriate target weight for that would be 250 milligrams. So these are all decisions we have to make about the formulation before we do any calculations. Okay? Last thing before we can do our calculations is to ensure that we understand what our ingredients are. And this is what makes, be honest with you, making capsules difficult, is that most of the time in pharmacies, the active ingredient, in this case indomethacin, we don't have that sitting around as bulk powder. Why would I have just a bunch of indomethacin powder sitting around? But what I do have are some of those commercial capsules, the 25 and the 50 milligram capsules. I got those. Can I use somebody else's capsule that contains indomethacin as my source of active ingredient? Absolutely. And so if you look on the compounding record here, that's what I'm choosing to do, is I'm going to go use the 50 milligram capsules as my source of indomethacin. But here's the deal. You're going to see in a minute. They're not pure indomethacin. Just like the capsules I'm making aren't going to be pure indomethacin. I have to take that into consideration. So you'll see why there's actually 2 lines for indomethacin. You can see there's a line here for the number of the capsules I'm going to go get, as well as the powder I'm actually going to end up using. And you'll see why we have 2 lines for indomethacin here in a minute, but that's why, okay? So beyond the indomethacin capsules as my source of indomethacin, I'm going to have to mix it with a certain amount of lactose, which is my diluent to make sure I have enough powder to fill my capsules. Then I'm going to use, what kind of capsules am I using? Clear. And so do me a favor. I left this off of here. It's bad me. My description of my capsules is incomplete. They are gelatin. They are size 3, but they're also clear. You must indicate the color of the capsule. So that should say gelatin capsule size 3, clear. Make sure you add that on there. And then lastly, we're going to add a drop of food coloring to help visualize the mixture. And you'll see that when Judy does it here in a minute. Okay? So we now know everything we need to know to do our calculations. So let's do our calculations. Are you ready? Get your calculator out. I want you to do these as well. Okay. So I'll remind you as well. Learning weeks, I give you step by step on what to do with the calculations. Exam, they're going to be blank. So, all right. So number 1, let's do this. How much indomethacin? If I'm going to make this batch of capsules, how much indomethacin, regardless of the source, do I need to prepare it? Well, it will depend on the number of capsules I'm going to prepare. So remember, how many am I going to dispense? I'm going to dispense 6 capsules, right? So I'm going to dispense 6, but I want to have enough powder to prepare 4 additional. So if I take the 6 plus the 4 extra, that equals 10 capsules to base my calculations on, okay? So if I'm going to base everything off of the preparation of 10 capsules, then I'm going to take my 10 caps that I'm going to make and multiply them by the fact that I know that each one is supposed to be 12.5 milligrams per capsule. Okay, so caps cancel. So what is 10 times 12.5? We get 125 milligrams. I'm going to put a capital I there for indomethacin. Okay, so that's your answer that goes into there. We need 125 milligrams of indomethacin. So far, so good. Kind of easy. And here's the, if we had pure indomethacin powder, we'd be done. All we'd have to weigh is 125 milligrams of indomethacin, but we do not have that. What we have is a 50 milligram capsule. So let's just determine how many capsules it would take to provide what I need, which is 125 milligrams. So if I need 125 milligrams of indomethacin, I'm going to multiply that by the fact that in one capsule, there is 50 milligrams of indomethacin, right? So then milligrams cancel. So tell me that. What is 125 divided by 50? I think that comes up to be 2.5. But can you just get 2.5 capsules? No, you can't. So you have to round that up. So what I actually have to go get is 3 capsules. All right. So your answer for that, oh, my light just turned off. Give me a second. You know, with as much as I gesticulate while I'm talking up here, you'd think you'd keep the lights on. But anyways, all right, are you with me so far? So 3 capsules. I want to make sure I understand this. How much indomethacin is in 3 capsules if each capsule is 50 milligrams? 3 times 50 is 150. So that's more indomethacin than I really need. I don't really want all 150 milligrams. I only want 125. So I'm going to have to figure out how much of the powder from those capsules I actually need to only have 125 milligrams. So at this point, I can't just calculate anything. I need to know the weight in the powder from those capsules before I can go on any further. So you'll notice the next step says to weigh the contents of the required number of indomethacin capsules. So Judy is in here, and we'll do that here in a second.
All right, so let's go ahead and measure the weight of 3 capsules. So I have a weigh those here labeled as I for indomethacin. I do not want a weight of the weigh those. So let's clear that. And let's place 3 capsules on the top to find out the weight.
So, and just to be consistent, let's write everything in milligrams. The scale reads it in grams, so I will read it off as milligrams. So that would be in milligrams, 1,399. Oh, let's make that, I like that number. I saw it, did you see it? Let's do 1,400. So 1,400 milligrams. That'll make life a little bit easier maybe, okay? Did you get that written down? Is that, wait a minute, that's wrong. Oh no, you're gonna have to erase that. That's not the right number. Judy, do you want to tell us why?
Well, we do not want the weight of the shell. We only need the weight of the contents inside the capsule shell. So what should we do?
Does that make sense? So the problem here is we are weighing not only the powder in the capsules, but the capsule shells themselves. So what we need is the weight of the contents only of those. So Judy will have to do that. What are we going to do?
All right, so we are going to place the weigh bow back Again, we hit already, so it's essentially 0. All right, I'm going to place the wayboat in front of me. What I need to do now is for the same wayboat, pay attention, for the same wayboat that we tear, I'm going to open up all the 3 capsules. So how do you open up a capsule? First of all, you want to make sure that your glove is very tightly fitting on your fingers, especially your thumb and index finger. You definitely do not want a loose glove. Indeed, if you have to, I would rather scale down, not scale up. All right, so the capsule has 2 parts, the shorter head and the longer body. All right, so with one of your hand, hold on to the head. This is where the lock is. There's a little lock here. So you want to gently squeeze the lock. At the same time, the other finger will twist and pull the body, try to pull them apart. All right, so one hand squeeze and the other hand try to twist and pull. And at some point you will feel the lock is being unlocked so that you can pull apart and you can squeeze all the powders out gently. And you can tap as well and double check before you say that's the end of the process. So that's good. So let me do one more slow down process. One finger hold on to where the lock is and one finger hold on to the capsule body. This finger should be squeezing gently. This 2 fingers should be twist and pull at the same time. All right, so you will feel the unlock, and as soon as it's unlocked, then you can pull them apart and gently get all the powders out. Tap, make sure everything is out, double check, and then you move on to the last one. With this one, and then I'm going to do a little bit quicker. All right. And double check. Okay, now we can go ahead and measure the weight of the powder.
So this will be the correct weight. If you can trust me now, I'm not sure if anyone trusts me, but this is the correct weight. So the weight you need to know, the contents of 3 capsules is 1,176. So 1176 is the weight. So now we can go back to our calculations. Down here now is 1. Oh my, that's nice and slow. 176 milligrams. Okay. So are you convinced now that that's not pure drug powder? Because if it was pure drug powder, 3 50 milligram capsules would only have 150 milligrams of powder in there, but it doesn't. So we need to set up a proportion. We need to set up a proportion of how much indomethacin is contained in that amount of powder. So let's do that. We just said there were 3 50 milligram capsules. So would you agree that there is 150, come on screen, milligrams of capital I contained in, that's the amount of indomethacin contained in what? The weight that we just wrote down. So in 1,176 milligrams, and I'm going to put a P for powder, okay? Because clearly that's not just indomethacin, there's other stuff in there. There's 150 milligrams of indomethacin in 1,176 milligrams of powder. What I can now do is set that equal to how much indomethacin do I want? The whole point was what I want for my prescription is 125 milligrams of indomethacin over X. And X will be the weight of that powder that provides me only the 125 milligrams of indomethacin. So solve for that. I've got to solve for it because we always have different numbers up here. So I'm going to take. Ooh, that's a nice round number. Did you guys get 980 milligrams? And I'm going to say P for powder, and that should be that weight there. So really, of that 1176, all I want is 980 milligrams of that powder, because that's the weight of the powder that will in fact only provide me 125 milligrams of indomethacin. Okay? So that's an important number. That is definitely one of our targets that we're going to write down here in a minute. Okay? But let's keep going on our calculations because we're not quite done. Okay? Because, let's see here. Come on. There we go. Now we got to look at our art form. What size capsules are we going to use? We said size 3. So based off of that decision, you guys memorize. So number 6 should be, well, since we're using size 3, each capsule is going to have a target weight of 250 milligrams. All right. So step 7 here, back up 1 second. If we were just putting powder in those capsules, each capsule would have 250 milligrams of powder. How much total powder do I need if I'm going to make 10 capsules? If I have 10 capsules and each weighs 250 milligrams, how much powder would I need? Well, just take your 10 capsules times your 250 milligrams per capsule, since that's our target weight. Would you agree it's pretty straightforward? We would need 2,500 milligrams total. I'm going to put a T there for total. That's the total weight of powder I would need to fill 10 capsules to 250 milligrams. Because then my last step is, well, how much lactose? I know now how much of my indomethacin I'm going to be using. How much lactose diluent do I need? Well, you're going to start with the total. We need 2,500 milligrams total. From that, let's subtract the 980 milligrams of our indomethacin. So what is that subtraction? 2,500 minus 980 equals 1,520. 1,520 milligrams now of lactose. So that's a capital L. So these are my targets. That's my target weight for my lactose that I'm going to add to my target weight of my indomethacin powder. And that combined would give me a total weight of 2,500 milligrams, which is enough weight to put 250 milligrams into each of 10 capsules. So let's go back and fill out our compounding record now that we know our target weights. So indomethacin capsules, how many did we go over there and get off the shelf to measure? We did 3 caps. 3 caps. Did we use all of those capsules though? We didn't, right? We're going to only weigh out a certain amount of that powder. So that's why we have 2 lines. We have one line that says how many capsules did I open up to get powder from? And the second line says how much actual powder are you going to use? Well, our target for that was the 980 milligrams. All right, I don't have an actual yet. So we'll do that here in a minute. I do know my target for my lactose is 1,520 milligrams. That's my target from that. I know I'm going to be using 6 capsules to actually punch or to dispense. So I know my actuals will be 6 capsules for my gelatin capsules. And trust me on this, you'll see here in a minute, there are going to be 1 drop for the food coloring. We'll explain that here in a minute. Okay. So you should have your compounding record all pretty much filled out except for the actuals for the indomethacin powder and the lactose powder. So before Judy comes up and makes it for us, I just want you to look at your procedure here. I'm going to point out some of the key words. Remember how Judy says we grade for certain key words in each of these steps here. So the things I point out to you, look on step 2. And certainly, as you can see here, the word triturate is important. As you're mixing these powders together, you are triturating them. Okay. Step 3, super important about the geometrically combining, geometric dilution. So you're going to geometrically combine these powders. Now, new one now. So look in step 4 here and make sure you understand and circle the word block and the word bed, because Judy is going to show you how to block the powder into a bed. So those are some unique terms for capsules, block and bed. And then the following steps, you're going to punch. So obviously punching is important, but step 5 has actually 3 things in it. You're punching how many capsules? 6. To what target weight? 250. Using what size capsules? Size 3. So do you see where it's punching 6 capsules to a target weight of 250 milligrams using a size 3 capsule? That's the level of detail. So circle that step. That's definitely going to have a lot of detail you have to include in there. And then the following things that are kind of unique are pinching the capsules closed and then polishing the final product. So those are the key terms. So with that, I will put Judy up on the screen and she'll show us how to make it. All right, we should be good to go.
Okay, so we need to finish the measuring of 2 chemicals, indomethacin. So I have a weigh boat. Now it says IF. That's my final weigh boat for indomethacin. And I believe my target weight is 980. Getting close. And take it back a little bit.
Okay, so write down this for your actual for the indomethacin powder, write down 987 milligrams. 987 milligrams for the actual weight for the indomethacin powder.
Okay, set this aside. Let's go ahead and measure lactose. This will be the final lactose going into my formulation. So pair the weight vote, and our weight is what, 1.52?
1.52, or 1,520 milligrams. What a little bit.
Ooh. Almost good. Is that good?
Yes, yes, that's
Oh,
fine.
it's too much. They couldn't
Still.
see from the opposite end.
That's a keeper.
Quite good.
That's very good. Oh,
That's quite good.
all right. So the actual for the lactose, 1,527 milligrams. 1,527 milligrams actual for lactose.
All right, now we are ready for the procedure. So now we are going to place indomethacin first into your model. Okay, and then because these two powders, they are very similar in terms of color, so I wanted to add 1 drop of food color to start with the procedure. So therefore, later on when I mix them together, it will help me a lot.
So let me just clarify this, because this has been a question that's happened this week. Why add the food coloring? Why is Judy adding food coloring here? Because do you see that the powder in the mortar is almost identical in color to the lactose, the white and the white. So by doing this, we're coloring the active ingredient to help visualize the geometric dilution. Okay, so if you already had a colored active ingredient, you don't need to add external color. But in this case, they were identical. So she's coloring the active ingredient green, so that we can visualize the mixture with the white lactose.
Okay, so that's good. The color looks uniform now. I know that I have more lactose here compared to the amount of indomethacin powder. So what I want to do is I want to add lactose twice using 2 additions. So that's about the first addition. And you see the very clear color difference because we added the food color. So let's go ahead and mix. Okay, in real life, I probably want to mix one more time for the demo purpose. Perfect. All right, let's go ahead and mix the second addition. Okay, so far all the procedures seems very familiar because this is the same as what you did for the powder. Now comes the new procedure, you probably haven't seen it.
So let me read it just so you know where we're on now. Judy's going to just do step 4 that says place the mixture onto a piece of ointment paper and block the mixture into a bed of powder using 2 large metal spatulas.
Okay, so a couple of things. In your drawer, you should have a whole stack ointment paper or parchment paper. Okay, usually they are on the top left, that's for the right side, the top right side. Okay, so you should get a piece of paper. You don't have to paper down the whole stack. Just get one piece. What I did here is that I actually have an ointment slab on the bottom. All right. So even though you have ointment slab on in your drawer as well, you do not have to use ointment slab. What you need to do is that use one piece of paper, ointment paper, and tape down on your bench directly. You can tape down on your bench directly. The reason that I have to use a slab is because we have a softy paper underneath it, where I cannot perform my procedure directly. So for me, I have to use a slab. You do not have to. Okay, all right. So the next step says, I need to transfer my powder to the ointment paper or the parchment paper. And after the transfer powder, I need to have 2 large spatula. Okay, and by using those 2 large spatula, I'm going to block the powder. How do you do that? So first of all, bring your powder to make a relatively square looking powder. Okay, and then using the large spatula, you want to press down really hard. You are pressing down so hard that you are actually making a powder bed, which is very dense. Okay, that is the reason that we use lactose. You want it to be very dense powder bed. All right, at this point, we are ready to do the punch method. Okay, so we are ready to do punch. How do we do punch? Okay, so pay attention. I do not want the weight of the capsule shell. So before I punch, I need to place the capsule shell in the weigh boat. It will give me some weight, in this case, 45-ish. I do not want this weight, so I want to pair that. So therefore, now I'm ready to do punch.
So let me just emphasize this enough, because this is probably the number one reason why you guys will lose points on the exam for your product, is that you make the product perfectly, but it has the wrong weight because you didn't offset the weight of an empty capsule. So every capsule you punch starts by tearing the scale with an empty capsule, so that when you take the measurement, you are only measuring the powder, not the powder and the capsule shell. That's a super important step.
Okay, so one more time, your capsule shell has two parts.
Hold on, I'm zooming. Okay, oh, you're in.
Okay. Your capsule shell has two parts, those commercial capsule shells. So you can easily take them apart. The short one is the head, the longer one is the body. We're going to use the body to do punching method. Okay, so place the head somewhere on your bench. And this is how you do the punch method. Basically, you're going to scoop from side. And as soon as you're somewhere in the middle, then you're going to flip over and then do punch. All right. So I cannot really do this procedure in a slow-mo. So let's walk through the process one more time. You scoop from the side and flip over and then do punch. All right. So let's see how I do. You scoop from the side, go in. As soon as you're in the middle, then you flip over and then you will do punch. At some point you think, oh, maybe I'm quite there. I'm very close to the weight that I need, so that you can place on the cap. But be careful, don't lock it because your weight might be wrong. So you just put the cap on loosely, not locked, okay? And now let's go ahead and check our weight.
Dun, dun, dun. So close. How close does it have to be? Remember, we will give you 5%. So go ahead and calculate what is 95% of 250. If our target is 250, what is 95% of 250? I think it comes out, and I'll spot you the half a milligram. It means you could be as low as 237. What is 5% over 250? Go ahead and multiply 250 times 1.05. You can see that she could be as high as 263. So 237 to 263. So some of you are looking at that and said, okay, that's a keeper, it's good. But that's, oh, there, see, it just moved a little bit. That's, I think, maybe a little bit low, especially on a test. You're going to want to be closer to the 250.
So I am going to do a little bit modification of the weight. What should I do then? It's too light. I'm going to do a couple more punch of the powder. But my bed is all messed up. So I'm going to make my powder bed one more time. Grab the powder and press down really hard. Usually, the tighter the powder bed is, the easier when you do punch. All right, so that's the good news is I didn't lock the capsule, so I should be able to easily take apart. Okay, all right, so now let's scoop on side again and punch one more time. Okay, I think that should be more than enough. Indeed, I kind of suspect that might be too much. All right, so let's see how it goes.
Oh, it's too fast. Now she's got too much.
That is way too much. All right, so then I needed to get rid of.
1 second, hold it. Let me zoom in.
Okay. So I'm going to get rid of some excess. By squeezing it, the powder will come out. So it's a really good adjustment that you have to do. All right, let's see how it goes.
A faster zoom. Dun, 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 dun. All right.
It's still a little too heavy. So let me do one more adjustment. Usually I would not have enough for size, for this kind of size. All right, hopefully this will be good. Oh my
Voila.
goodness, am I good enough?
All right, guys. Now you don't have to cheer or clap. We couldn't hear you anyways. But anyway, all right, guys. So that's a keeper, but we're not going to write this weight down. Let me just say this. You are going to, in your QA section, you have to write individual capsule weight. So every capsule that you end up dispensing, you have to write the individual weight down. However, we've still got 2 more things to do before we document the weight.
Okay, so this is not quite ready to be dispensed yet. One, because the cap was locked, it was not locked on yet. So you need to do the second piece. There are 3 pieces you have to do. The first one is a punch, we just said. Here comes the second one, which is pinch. And you have to pinch down the capsule shell until the point that you feel a little click. That means now it's locked. You are no longer able to pull it apart. Okay, so that's the second P, pinch. Here comes the third P, polish. So you want to grab a piece of tissue and polish the exterior of your capsule to make it become powderless and shiny. Now let's go ahead and double check our weight.
So this would be our actual QA weight. So everyone, let's write down 250 milligrams. We got a spot, Judy, for that. So that was right around 250 milligrams. That would be, and again, you don't have to say capsule number 1 because we'll never know which capsule was which, but we're going to write each individual capsule weight. So 250 milligrams for the first capsule.
Okay, so let's move on to the next capsule again. After I finish about working with 5 capsules, this is about among the powder I left, okay? So at this point, it gets a little bit harder to work with the powder since I don't have a lot. So what should I do? I'm working on my last capsule. By the way, you always have to tear before you move on to the next capsule shell. They should be similar, but they could be different. These 2 are very identical. All right, so here comes the last one. What should I do? Again, using a larger spatula. Okay, try to grab your powder together and then make a very tight powder bed. And the capsule shell, you open up, okay, place the head somewhere on the bench. Using the body, watch me, you are going to squeeze against the larger spatula. So this is the dam method because the larger spatula is serving as like a dam, blocking the powder so that you can squeeze against it. All right, so it does get a little dusty using this method because your fingers are worked into the powder. So there's like a whole bunch of powders actually on my finger using this method. So at some point, I think I'm getting close. And then we are going to check the weight.
It's a keeper.
Almost good, but as you guys know that I want to be perfect. So this is not good enough yet. However, if I'm using the same method, it's just not working because I'm not able to pack enough powder into. So here comes the third method. If you're really having trouble packing enough powder, in the lab, I think you guys are working with size 3.
2.
They're working with size 2. Oh yeah, so I'm working with size 3. Size 3 is a little harder to pack enough powder. You shouldn't have this problem. But if you're working with a smaller capsule that you have trouble packing enough powder, here comes the third method, which is the cheating method. All right, instead of using the body of the shell, we're going to use the head of the shell and just scoop a little bit powder. Okay, and then try to see the weight. Oh my God, I'm just really good at this.
He's on a roll. So again, we won't put that down as our final QA weight. She's got to do the last 2 steps and then we'll get our final weight.
All right, don't forget the pinch and the polish. But before we do that, I want to place those 2 capsules over here. Hopefully that you can tell the difference between using your imagination that tell you this one is the pinch one that's shorter and this one's the longer one that's non-pinched. All right, so here is the pinch. You pinch to the point that you feel the click. That means it's locked. Now go ahead and polish your effect. Well, for me, this is my last capsule. You polish it. It's shiny now. And go ahead and double check the weight.
249 milligrams. So the QA weight would be 249 milligrams. And she would continue to do that until all 6 capsules have been compounded. Should there still be some extra powder left? There should be a little bit because we calculated for 10, but trust me, it disappears. And what Judy was trying to say is that the first couple of capsules are easier to punch. The last couple of capsules, because there's not as much powder left, it gets much more difficult. So your capsules tend to be lighter. You have a hard time getting them heavy enough to the target weight. That's where the sliding method and the kind of the cheating method of putting some powder in the capsule cap actually will help you get to the right weight. So those are things you can do. So let's see here. Let me get things switched around one last time. All right. So with that, let's kind of finish up on our spiels here. Okay. So what else do we need to know? You need to finish your QA documentation. So you would actually have the QA weights for all of your individual capsules. We assume you've got those. We still need to complete the product description. So the part that you have to describe are two things. You have to describe the powder and the capsules you're using. So let's describe the powder inside the capsule as fine in texture because we triturated it to a nice fine powder. So it's a fine light green. So do that in whatever order you want, light green fine or fine light green powder. So fine light green powder contained in a size 3 clear gelatin capsule. So whatever order of those things you want, but it's a size 3 gelatin capsule. All right. So fine light green powder contained in a clear size 3 gelatin capsule. Beyond use dating, let's determine the beyond use date. To do that, we've got to go back to our ingredients and look to see expiration dates. Which one has the shortest expiration date? Let's see here. If I was going through that list, I'd say it looks like that one has the shortest expiration date. However, that expiration date is all over a year from now, because this is 2021, that's May of 2022. So that's like over a year from now. So clearly the shortest expiration date would be 6 months from today. Since today is March 24th, let's see, 3 plus 6 is 9. So your beyond use date would be 9/24 of 2021. Okay, so 9/24 from 2021, 6 months from the date of dispensing. Says each ingredient, the shortest ingredient was well more than a year. Okay. Storage, same as powders, just as important though, you got to have room temperature and airtight container. So room temperature, airtight container. All right, now this is probably, I only laugh because this is where many of you will probably lose a point or two because there is special documentation for capsules. And it's hard to remember because it is only done for capsules. But would you agree that a lot of the formulation, the amount of lactose and all of that we use depended on the capsule size? So the capsule size we choose is important. And since the doctor didn't actually indicate that and normally never indicates the size to use, we need to, for capsules, clearly indicate, this is important, on the face of the prescription, the size and type of capsule we use by drawing a triangle, putting the number representing this capsule size in the middle, and writing below that the color of the capsule. In this case, not the color of the powder, it's not the green, but the capsules we used were clear. So everyone, let's go pull up your prescription and go to the actual hard copy of the prescription. And right in the middle, right in the front here, let's draw a triangle. And put the number 3, since we used a size 3, and put the word clear down below, okay? So that's the additional documentation you have to do on the face of the prescription to make sure that you indicate what size and type of capsule you compounded, okay? So I just remembered, try to remember that. That's a memorization-y thing because it's easy to forget. The good news is the drug naming for capsules is easy. It's drug name and strength and dosage form. So just like a normal prescription might be Prozac 20 milligram capsules, in this case, we made indomethacin 12.5 milligram capsules. The only thing I want you to do for me is, since these are compounded capsules, you need to say oral capsule, because pharmacists can compound vaginal capsules. We can compound odic, or capsules to be used in the ear. It's not always just oral capsules that we compound. So it would be important to indicate these as oral capsules. So indomethacin 12.5 milligram oral capsules. The other good news is there are no required auxiliary stickers because the dosage form is a capsule. Okay, so there's nothing I'm going to grade for. Now, in real life, there are auxiliary stickers because of the drug. So, for example, indomethacin absolutely needs a take with food sticker because it can be rough on the stomach, but that's because it's indomethacin, not because it's in a capsule. Since I'm not worried about you learning about the drug-specific counseling at this point, just know I am not grading for any specific auxiliary sticker because we're making a capsule. Okay? That's it for the dry lab. I think you're pretty much ready to start on the wet lab prescription, but yours is a little more complicated. So let me just kind of clarify a couple of things. Let's look and read and interpret your prescription here. Instead of just making a unique strength like we did for the indomethacin, you are, for Joel Bontrager, making both a unique strength and a unique combination. You're actually going to combine two drugs together into one capsule. You want to make sure that each capsule you make for Joel has both 5 milligrams of propranolol and 6.25 milligrams of hydrochlorothiazide. Okay, so you're going to have the right strength of two ingredients combined into a single capsule. All right, you're going to need to dispense 6 of those. All right, and there you have it. If you look in the additional information, I'll remind you today to base your calculations on 4 additional capsules so that you have enough powder to be able to dispense at least 6. And for you, the only capsule size I have set out for you to use is a size 2. And remember, since you're using a size 2, a slightly larger capsule, your target weight needs to be 300 milligrams. So use that to kind of formulate that information, okay? So I will remind you, there's a couple of things here, just going forward. Your source of active ingredients are going to make your calculations a little more difficult. Like I said, you do not have bulk powder for either ingredient. Your propranolol comes from 10 milligram tablets, and your hydrochlorothiazide comes from 50 milligram capsules. Okay, so you're going to have to do something very similar to what we did with the indomethacin for the hydrochlorothiazide. Let me just say this though, because the propranolol is from a tablet. We didn't show you a tablet. The one thing I'll say, and this is not the right number, you're going to do your own calculations, but it does turn out for propranolol that you need an even number, a whole tablet. So let's just say 7. You need exactly 7 tablets. That's not the right number, but let's just say you will be exactly the right same full tablet, 7 tablets. So you will need the weight of those 7 tablets. A tablet, though, does not have a shell. So does the weight of a tablet the same as the weight of a tablet once it's crushed up into powder? Yes, it's the same weight. So you do not need to crush up the propranolol tablets. Just weigh the number of tablets, whatever that tablet is that you need. The weight of them as tablets is the same weight as it is as a powder. So and it's more accurate to just leave it as the tablets. Okay, so you will just calculate and weigh the X number of tablets. Unfortunately, for hydrochlorothiazide, it's not so simple. Well, like just the indomethacin, the number of capsules is actually excess the amount of powder that you need. So you cannot complete these calculations until you go get the number of capsules, open up and retrieve the powder and obtain the weight of that powder and set up the same kind of proportion as we did for indomethacin. Okay, so just be aware of that. Having said that, you can help each other, talk to each other, ask Judy and I, we're here to help you. I have posted a key for all of these calculations on the supply stations by the sink on the north side. You will notice some of the text is red. Those are things you can just directly calculate, but my weights are in blue. And so some of my numbers depend on my weights and your weights are going to be different. So you cannot just use my weights. You need to weigh and set up the proportion and do it yourself because you will not have my key on the exam. So practice that, but realize when you check your answers on my key, our weights may not be exactly the same, so our final numbers will be close, but not exactly the same. But definitely check your calculations first. Make sure you got the right numbers before you make it, okay? As far as making it goes, I will tell you, your propranolol tablets are yellow. The hydrochlorothiazide is a bright yellow, so your active ingredients are a nice yellow color. Therefore, you do not need to add the food coloring. I have food coloring out there because next week you might need to add food coloring. How will you know? If your active ingredients are white and the lactose is white, you add food coloring. In this case, your active ingredients are yellow and your lactose is white, so you don't need any external food coloring. So in that case, you don't need to worry about that, okay? Then you'll go through this whole process and punch your capsules. Remember, what you're going to bring over to us to grade is a weigh boat, just whatever size weigh boat, of your capsules to dispense. And I say that because you're only dispensing 6 capsules, so only bring over 6 capsules. You will lose points on the exam if you bring over 7 capsules, because just in case one of them was bad, oh, it don't work that way. I'm going to just, whatever you bring me is what you're dispensing, so only bring over 6 capsules. Having said that, for checkout, to get out of lab, you have to make everything. You'll have a weigh boat of 6 capsules. You'll have your handout and write-up. You will come get a number and we'll call you over. So on the exam, here's the deal. We will QA your capsules right there in front of you. We're going to look at them for the appearance. They need to be shiny. We're going to look at them that they've all been pinched closed without any gap at the top. And lastly, that they are the correct target weight, meaning 300 milligrams plus or minus 5%. All right. So here's the deal. You are graded on your worst capsule. So if you have 5 capsules that are right at 300 milligrams and 1 capsule that's 240, guess what? You get 0 points. Your grade is based off of your worst capsule. Again, I'm not having you make 100 of them. You're only making 6 of them. So you need to get 6 good ones. So again, you're graded on your worst capsule. It will not be an average weight. We will weigh them individually. Today, we're going to do it the same way we're going to do it on the exam. You'll be with us and you will see and watch us weigh each one of your capsules individually. If any of them are outside of the range, you would lose the credit. So let's just talk about the range. For 300 milligrams, it's as low as 285 and as high as 315. Trust me, because our scales aren't going to be exactly the same, you should really stick between 290 and 310. If you give me about 5 milligrams of leeway, that means you keep yourself within 290 and 310, I'll give you 285 to 315. There's usually no problem with the weights of your capsules. Just a thought in terms of your compound, okay? Beyond that, I guess I would just say don't forget to complete all the other documentation. You have to have your beyond use dates and everything else written out and ready to go. Then you get your number, bring over that handout, your thing, and we'll grade it for you, okay? So don't forget to do the rest of that. Last thing I will say is that the errors and omissions. We're not going to spend time on doing this right now. I know that. I have posted an electronic version of the key in Blackboard. Practice this. Do not look at the key. Do it yourself. See how many errors you get before you check the answer key. Remember, the errors and omissions is 25% of your grade. You saw how hard it was last time. You got to keep practicing that. So practice that and be prepared for it. So now the last thing is Judy is going to go through and just mention a couple of things for checkout that we're going to do as a group here. That way, when we do check out with you, we will just do your quality assurance for your products, your capsules, and then you'll be able to free to go.